Knock knock. Hey Abby,
Hi.
how you doing today?
Good, how are you?
Good. My name is Riley. I'm a student nurse practitioner at Youngstown State University. What's bringing you in today?
I'm just here for an assessment.
Okay. Looks like today's agenda we're going to be doing a chest, heart, and lung assessment. I'm just going to ask you a couple general questions real quick.
Okay.
Have you been experiencing any shortness of breath recently?
No.
Increased fatigue?
Mm-mm.
Trouble going up and down stairs or like walking to your car?
No.
And then how about any like chest palpitations, chest pain, anything along those lines?
Nope.
Good. So I'm gonna kind of have you turn towards the camera just for a second, and we're going to start our assessment with your chest. And I'm gonna just be doing a generalized inspection right now. We're going to assess the shape and size of your chest, which appears to be normal for your size and build. I'm going to assess symmetry with respirations, which it appears that your chest rise and fall is symmetric bilaterally. We are going to assess your anterior, posterior, lateral diameter, which is 1 to 2, which is appropriate. And throughout the exam, if you have any questions about what I'm saying, feel free to ask. I will try to explain it to you as best as I can. I'm also going to kind of lift up your shirt here. I'm going to assess for any rib protrusion, which I do not see any. Rib protrusion, Abby assesses to make sure that there could be no scoliosis, because that can cause trouble with breathing, okay? Next, I'm going to assess your pulse here. Pulse is right around 76. It is +2, palpable. It is not thready. And then while I was assessing your pulse, I was also watching your respiratory rate. It's approximately 16 respirations per minute, even, non-labored, and there is no use of accessory muscles. Next, Abby, we're going to do some palpation here. I'm going to assess a couple anatomical landmarks on you. So I'm going to feel your trachea here. Good. Now I'm going to assess your suprasternal notch. Good. And then we're going to move down to your angle of Louis. Excellent. I'm also going to check your sternal borders here. Good. And then just the sternum. Any pain with that? Good. Next, I'm going to kind of have you turn away from the camera because we're going to assess you for something called crepitus. That's where air can be filled in the adipose tissue space, and it'll almost feel like a popcorn sensation. So just gonna kind of feel around here. And have you lift your arms up for a moment. Check the other side. Good, and then just your front. Excellent. With you turned that way, we're going to assess something called fremitus. I'm gonna have you say either the phrase blue balloon or 99. I'm gonna have you kind of pull your hair around to the side for a second. And I'm gonna have you begin.
99, 99, 99, 99, 99, 99.
Excellent. Next, I'm gonna assess you for thoracic expansion. I'm kind of gonna kneel down here. I'm gonna put my hands around you, and I'm gonna have you take a big breath and exhale. All right, thoracic expansion is normal. Next, we're going to do something called diaphragmatic excursion. I'm going to have you take a deep breath, exhale and hold, but I'm going to assess your resonance first. So you're going to feel me kind of tapping on your back here, okay? All right, go ahead and take a deep breath, exhale and hold. All right, take a deep breath and hold. All right, gonna use my measurement here. And it is approximately 4 centimeters, which is right within your normal limits. We like to see anywhere between about 3 to 5 centimeters. So next, we're gonna just assess your sides for percussion. On the back, we were assessing for any hyperresonance, which there was none noted. Hyperresonance, Abby would assess for like COPD. It's air-filled, that sacs that aren't able to escape. Like I said, it looks for COPD, which you do not have any hyperresonance noted. Next, we're going to auscultate. With you sitting just like that, we're going to start with your posterior, and we're going to be using the diaphragm of the stethoscope. I'm going to be having you take some deep breaths. If at any point you feel lightheaded, just let me know. I'm going to slide your hair onto the side here. Get rid of this tape. And go ahead and take a deep breath. Again. Excellent. I'm going to kind of have you lift your arms up just a little bit. Deep breath. I'm going to come underneath a little bit. Sorry. Excellent. We're going to go to the other side now. And I'm going to pull your shirt away and come under. Excellent. And just the front here. So no adventitious breath sounds were heard. Those would be stridors, wheezes, rales, or rhonchi. She also, during my general inspection, there are no audible wheezes or stridor heard. Next, Abby, I'm going to go ahead and have you lay down. Go ahead and put your head up here for me. And we're going to assess your anterior. Excellent. All right, you can go ahead and sit back up. Your chest assessment revealed no abnormal findings or findings that would be concerning. We're going to go ahead and move on to your heart, okay? We're going to begin. I'm going to kind of have you sit back forward again here. I am going to bring your shirt down, and I'm going to look at your precordium here. And just breathe normally for me. During this assessment, I'm looking for any heaves or lifts or pulsations, which I do not see. I'm also going to lift your shirt up here. And from an angle I'm going to assess, I'm going to try to keep you covered the best I can. Also assessing for heaves and lifts or pulsations, which I do not see any. Excellent. I don't know if I noted earlier, but I was assessing during the lung assessment for any rib protrusion, which, like I said, I did not note any. Next, Abby, I'm going to go ahead and have you lay back down, and I'm going to palpate with the palm of my hand for any thrills. I'm gonna come underneath your shirt here, so sorry. I'm gonna come up from down. Next, I'm going to assess your apical pulse. You're going to feel me kind of displace your breast, and I'm going to kind of press a little deep. And I'm also going to have you turn up onto your left side. It kind of causes the heart to fall, and I'll be able to assess better. Excellent. Thank you. Next, we're going to go ahead and auscultate the heart. You can go ahead. Did I have you sit back up? I'm going to have you lay back down. Sorry about that. We're going to auscultate the heart, beginning with you being supine. We're going to use the diaphragm, and we're going to begin with your aortic valve, which is going to be your second intercostal space, right midclavicular line. We're going to move on to the pulmonic, which is second intercostal space, left midclavicular line. S2 is greater than S1 while assessing the pulmonic valve. We're going to move down to Erb's point. Erb's point is third intercostal space, left of the sternal border. I'm going to come up and listen to your tricuspid. and we're gonna move to your mitral, which is gonna be your 5th intercostal space, midclavicular line. S1 is greater than S2, and at the moment I do not hear any extra heart sounds. That would be S3, S4, or splitting. I am now going to use the bell of my stethoscope and listen for murmurs, and I'm going to start at the mitral. I'm going to move up to the tricuspid, come down to herbs, pulmonic, and aortic. Excellent. Okay, Abby, you are able to sit back up now. And last but not least, I'm just gonna kind of have you lean forward like this. And the reason why I'm having you lay forward here, Abby, leaning forward, is it kind of displaces the heart. It brings it closer to the chest wall so that I can assess. And we're just gonna listen to you one last time here, okay? Down to herbs. I'm gonna come up from underneath. Tricuspid and mitral. I'm gonna move over to the bell, and we're gonna reverse. Back to herbs, pulmonic, and aortic. Okay, so I did not hear any murmurs. However, in the event that I would hear a murmur, Abby, I would assess the timing, pitch, grade, intensity, pattern, quality, location, radiation, and changes with respiration. One last thing that I would like to do, because I missed it, is I'm going to listen just one last time, but I'm going to have you hold your breath, okay? We're going to use the diaphragm first. Go ahead and hold. Aortic, pulmonic, herbs, tricuspid, mitral. Go ahead and breathe. And hold one last time while I use the bell. Tricuspid, herbs, pulmonic, aortic. Okay. Today's assessment did not reveal any abnormal or acute findings. Do you have any questions?
No.
All right. If you do have any questions, go ahead and give me a call. But otherwise, today's assessment was great.
Okay.
Thank you.